Good day everyone, I am VINNISE Marime Tumulak from BPED 1A. For today's video, I will show you about the 12 cranial nerves assessment, namely olfactory, optic, oculomotor, tracheal, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, and hypoglossal nerve. But before we proceed in assessing the client, we need to remember these 3 things to do. Provide privacy, perform hand hygiene, and explain the procedure. So, in cranial nerve 1, which is the olfactory nerve, the sense of smell. So, all you have to do is I want you to close your eyes and breathe mindfully. Inhale, exhale. Now, what is this?
Efficacy.
And this was efficacy, and that's correct. Cranial nerve 2, which is the optic nerve, there are 2 tests. Number 1, look at the confrontation visual field. So in the visual, then visual acuity using Snelling chart to assess that. So, all I have to do now is I want you to cover your right eye on your right hand. The next is on your left eye, and then on your left hand. Then next is you have to read it with both eyes. So I want you to read the line 8 with cover.
D A F P O T A C.
Next is on the 6th line with cover.
A D F C Z P.
Then I want you to read it with both your both
D
eyes.
F C Z P. D A F P O T A C.
So in that line, it means that he has an 8th line vision. It means he can see the line in 20 feet. Person with normal vision. However, in the line 6, his left side, it means normal vision. He can see the line in 30, which is 20/30. Cranial nerve 3, which is the oculomotor nerve. Cranial nerve 4, which is the tracheal nerve. And cranial nerve 6, which is the abducens nerve. First, is we gonna looking for involuntary shaking of the eye. So, I'm gonna take a flashlight of my cell phone. We're gonna hold it about 12 to 14 inches away from the patient's nose, and don't move. Keep your eye to watch the move of the flashlight, and as you're doing this, you're gonna perform this in a 6 field of gaze. So, there we go. Just look at this. Next is we're gonna see how the pupils are reacting to light. And to do that, we're gonna dim the lights a little bit, and we're gonna have the patient to stare at the distant object to dilate the pupils if they constrict it. So, then next is again, I want you to stare this pen, this flashlight, slowly move it inward to the nose. So I want you to follow this flashlight and don't move your head, okay?
Okay.
So we can document that the pupils are equal, round reacted to line, and accommodate. So that's where the acronym PERRLA comes into play. We're gonna go ahead in cranial nerve 5, which is the trigeminal nerve, and this nerve is responsible for many things, like mastication. So, I want you to clean your teeth and bite them for me. And I'm going to feel massage the muscle on the right there and feel the temporal muscle. Now open your mouth. Try to do that for me, so he can do that. Then look at the facial expressions on cranial nerve 7, which is the facial nerve. So can you close your eyes and open your mouth? Okay. Now smile for me. Pout. And pop out your cheeks. Okay, and he did that with ease, with the cranial nerves intact. Next is cranial nerve 8, which is the vestibulocochlear nerve. And what I want you to do is to include one of his ear and whisper to Ward on the other side, and he needs to tell me what I've said. So, you ready?
Yes.
Cut, go.
Cut, go.
Yes, no.
Yes, no.
Okay, and that's nerves with intact. Next is cranial nerve 9, which is the glossopharyngeal nerve. So I'm gonna do is I want you to say ah, and I want you to move up. So I'm gonna test the gargling. Okay, that's really good. In cranial nerve 10, which is the vagus nerve intact, because he is able to talk to make hoarseness and he is able to swallow. So I'm gonna do the cranial nerve 11, which is the accessory nerve. So I want you to move your head side by side, up and down, and shrug your with my resistance. Okay? And he does with ease, so that nerve is intact. In cranial nerve 12, which is the hypoglossal nerve, so I want you to stick up your tongue, move side by side. Okay, and he does that with ease. So that's all for today. I hope you have learned something in this video. Thank you and God bless.